Hello and welcome back to You Matter. This is session 10. In session 10 today, I will be having a conversation with physiotherapist and business owner Katie Knapton. Way back in 2016, before most of us had thought about doing video consultations, Katie set up Physio Fast Online, which is a platform to deliver good quality care and advice to patients via video consultation. Now, you'll hear through the course of this discussion that it's not the video consultation which is Katie's thing. Katie's thing is making sure that patients have quick and easy access to good quality advice and care. She wants patients to be excited about seeing physio, knowing that they will be able to reduce their worry, they'll get education about healing, they'll get good advice about exercise, they'll be able to get active again if that's appropriate. She wants to make sure that people don't get lost in the system. And what I love about Katie is she's kind of an advocate for the underdog, the patient that potentially isn't getting the advice they need, is getting stuck in a system and just not getting access to the help they deserve. So Katie and I talk about the history of setting up Physio Fast Online, and we also reflect on our quite lengthy careers in physio now and the things that we've seen change, things perhaps we would have liked to see change more quickly or differently, and also the things that we think are really positive in the profession today. So I really hope you enjoy this conversation. As ever, I'd love to hear your feedback, but for now, make yourself a cup of tea or whatever, sit back, enjoy the conversation, and I will be back at the end. Hello and welcome to the latest session of You Matter podcast. And I'm here today with Katie Knapton, who is one of those people that I met quite early on in the pandemic online, has become a great friend and someone I very much look forward to meeting in person very soon. So Katie is an MSK physiotherapist, very well respected physiotherapist, and in recent years, she has moved, she still runs her own clinic, I believe. I'm going to get her to tell you more about it in a minute, but she has also developed Physio Fast Online, which is a platform for delivering MSK services. And I'm going to let her tell you a little bit more about how she came to get that idea and what built up to it and how it's going. So over to you, Katie.
Thanks very much, Jo. I feel it's rather generous to say I'm very well respected, but anyway, so yes, I've been qualified rather a long time, too long really, since '91, and have followed a fairly typical journey of the sort of '90s in terms of basic grade and rotations and all that, which has all moved on a little bit. Yeah, exactly. And then it ended up specialising in MSK. Worked a bit in Australia and then did a fairly classic senior role and ended up at an ESP role in St George's, which I loved, and then moved out of London, which is when I established my own private practice, which was now back in 2003. And then in 2016, I think it was, I had a sort of frustration moment. It might have been an age thing, but we won't sort of discuss that too much. And I just felt that patients, where do they go for good advice and information? And I think I'd had a couple of runs of patients who hadn't been dealt with very well. So I had a ruptured Achilles that hadn't been diagnosed. So by the time we got him, it was lengthened and it was too late really for anything, and no one was interested in doing any surgical management. And that really upset me, because what he'd done was he'd split up from a long-term relationship. He'd got all his tennis gear and gone up to the tennis club to try and reinvent himself. And within that first 5 minutes, unfortunately, he'd ruptured his Achilles.
Oh,
obviously, yeah, he'd overloaded. But, this chap was in bits emotionally and in all sorts of ways, and physically by the end of it. So we got him back to a reasonable, but he was never going to manage to hit the tennis courts because he was 65 and it was a little bit tricky. But so I just sort of wondered, well, where do people go? Where do they get the right advice? And if you're not always getting the right advice from your GP, or minor injuries, what do you do? So we've got to bear in mind this was pre-COVID, and I thought, well, actually, a video conversation with a physio would be really useful if that physio had some knowledge, was up to date and used, the best evidence and best practice. And so that's where I sort of got it from. So that's my idea. And then what did I do? I think I happened to have a patient who talked about investing. And so I put a sort of investment pack together and did a presentation and a little bit of a Dragon's Den moment. And I got some investors. And that's how we set up Physio Fast Online. And that's what it's been. And the aim is really just to supply easy access, quality physiotherapy information and advice. And at no time have I ever tried to replace physical physiotherapy, and I don't really dig that debate very much. But we do know that we can help a lot of people without any manual treatment, and that is the idea. Or we can guide people to the right treatment. And that's really, so my passion is that people get quality stuff.
Yeah. So you said 2018, didn't you? When 16, sorry. So well pre-pandemic, and there's been so much talk about online delivery since the pandemic, but you were, I don't know, do you feel like you were ahead of the game, or was it just that, why did you take it online then? What did you perceive were the reasons that online at that time could do better than the current systems of GP referral, face-to-face physio?
I suppose mainly it's the wait times and the difficulty, people, if they're going to a clinic, they have to take time off. And if they just need some advice then and there, why not make that easy and available to them? And it just seems a sensible thing. And I'm not the first physio to do that. There's been physios doing it for ages. But it was perhaps the first to think of running a clinic specifically just for online care.
Yeah.
So it's not particularly novel, but it seemed obvious to me.
Yeah, you say it's not novel, but we're also familiar with Zoom and this kind of delivery now. But did you have to kind of check out the platforms, and were you the first person that you need to be using them? Did you hit any resistance?
So it was quite a learning curve. And as you say, in that time, we did start off with Zoom, but because Zoom required a download, we found that was a barrier. So any barrier to someone actually having a successful appointment is a bad thing. So we quickly went onto a web browser-based video consultation software, of which there's a number. Now probably if we use Zoom, it wouldn't be such a problem because lots of people have already got it downloaded on their computers. But so I did sort of work out that anything that created a barrier would prevent a successful
process.
Yeah, sorry.
That's all right. And do you feel now that has the pandemic helped PFO to grow? Is that exposure been helpful, or is it not quite in line with why PFO was started? Is it helpful or a hindrance?
I can't decide. So we had, initially sort of the investors were very gung-ho and we were, ahead of the game. But were we too early? Because all we got on board was your sort of early adopters and, and the people who got it. Yeah. But you still couldn't sell it to the people who didn't get it. And I'm thinking now, yes, we've had certainly a bit of a surge in demand, but everybody's doing it.
Yeah.
And you sort of think, well, is that a good or a bad or indifferent? And I don't really know. So I think it should be good because it makes it an established way of practicing. And I know that not everybody wants to do it, which is also fine. And not everybody's good at it. So, so those that recognize that perhaps it's not their thing, then that's absolutely fine, because look, there's always going to be plenty of patients who are going to go into clinics. So it's, we're never going to change that. And that's all good. We all need to, earn money. So I think overall it's probably positive until we start having the arguments and the debates and the issues like the GPs are having at the moment, which is causing a lot of problems. And I think what we need to talk about really is quality. So it's not how anything's delivered, it's the quality and the value. What does that patient get out of it?
And in your experience of delivering online, what are the things that make the difference from a good quality video consultation to a poor quality one?
You ask the patient what they want. It's a basic thing, isn't it? So what do you want? Hi, you've booked a video consultation today. What are you hoping?
No different to face-to-face.
Really shouldn't be. And there's no reason why it should be. And when you get to the end of that consultation, have you got everything that you want? And that you send them the information that you promised them with the advice. And if that, I have some who are really pernickety about, well, what should I be doing week 1? That's fine. I can tell them that. And if they're happy because they've got that information, then that's great.
Yeah, and I know, this isn't the first conversation we've had about this, Katie, and I know the driving force behind anything you've told me about has always been this thing of quality care. And it sounds as if for you it's that early stage stuff, making sure that someone gets on the right track from the word go. And I can really see how video does work really well at that point. Definitely further on as well for the right patient and with the right condition. But would you agree it's getting in there, for you, the quality is getting in there quickly with that good advice and early resources?
Yeah, I think, that's when it works well. So as I said, so that, there's a lady that had seen the GP, been to the hospital, whatever. But, when I saw her on video, she lifted her hands up. She had dactylitis, so why wasn't she under rheumatology? So someone we could guide. So yeah, if we can get to people, have that conversation, get them to show us things, talk about, lifestyle changes. I've got, advised patients onto HRT, stress fractures. You name it. A lot of it has not been sort of lots of ongoing physio, but we've helped give them the information that they need to then go and take the right steps for them. So it's not, I sort of now think, am I really an MSK physio? Because I feel quite generalist. So I know I can cover lots of aspects of women's health. So, I can have some conversations. I'm happy then to refer on to an expert. Don't get me wrong. I have limitations, but I can have all those conversations because I've got enough information to have those conversations. And I'm comfortable to have conversations about all sorts of things.
Yeah, and what I love about you, Katie, is something that I know in our previous conversations we've ended up terming health advocacy. And what I love is that you almost seem willing to take on this advocate role for a patient, and exactly what you've just said. If it's not a sort of cut and dry, straightforward MSK case where I don't know, most people probably know how to manage a sprained ankle reasonably well these days and know the path they should be following. Not always, obviously, but you seem to be a real champion for the person who may not have realised that the menopause issues were contributing to their back pain, or who they should go and talk to for that. And I feel that really strongly with you, that advocate role.
Yeah, well, I suppose I've never really seen it like that, but
not till I told you you're an advocate.
I am an advocate. No, I am incredibly nosy, and I suppose I am quite passionate about people not being hard done by.
Yeah.
I do worry about. I always sort of worry about these patients that get lost in the system, and I always feel there should be someone championing these patients and helping guiding them through, because it's a scary place out there if you're not really strong. You can get lost in the system. When the system works, it can be fabulous, but there's a lot of people not getting the attention or quite the right assessment that they need. So I suppose I am a bit loud.
And do you think, so obviously, when you're working individually with a patient, you can perform that assessment and have those conversations about the contributing elements that are going on for that patient. Do you think, how do you think we improve health advocacy in a more general way? Should we be looking at more online education for patients, or I don't know, where do you see that we could get good bang for our buck in terms of reaching a lot of people?
Yeah, I think it's incredibly tricky, isn't it? So, you just have to look at the number of health apps that they're out there, and how confusing is that? because there's loads. So I don't know quite where to sit it. I mean, I think it should be sat within the, your local communities, perhaps, so your social prescribing, although I'm never quite sure how to access that in my locality, so I don't know if you know about yours. But all of that sounds great, but we still need to I guess it's just keep on working on it. And I guess I can only change it in my small way. So I think that every patient I see, we try and have a more general conversation. And then from that, hopefully they will then feed to their friends. So if every physio was doing that with every interaction they have, then we're already getting known for the fact, oh, actually the physio told me about that. That's really good. And I think that's the starting point, because we've got all our health guidelines, haven't we? We've got our 150 minutes a week or whatever. But we still struggle. So it's, again, if you can give that patient that information that's relevant to them, and they can understand it and educate them, and then they try and get them to spread the word, I think that's the way to do it. Because if it's always top down, it's very off-putting for people.
You're talking more about health promotion, aren't you, really, rather than treatment? So that early intervention side of things. Yeah,
prevention is the way to go, isn't it? So if we can stop people, yes, I know that it's gone down on the scale of the sort of WHO problems, but our inactivity is a huge issue, and everyone's talking about they're seeing more frozen shoulders. Well, is it because of COVID? Well, I question whether actually it's just due to the fact that people are not being as active as they used to, because they're not commuting, they're not doing this, they're not doing that. I don't know.
There was I can't remember where I saw it. I'm feeling it might have even been in Frontline. Somebody listening will remember, I'm sure, but I do remember reading an article a few years ago where someone was putting forward a role where somebody in each town was looking at the facilities that were available to exercise, and even going as far as working with planners, particularly if there was new builds going on and there was funding for public services and things like that, just to check that as far as possible there were facilities for people to exercise in some way, shape or form in as many communities as possible.
I don't know, I mean, that'd be great, but looking around where I live, I can tell you that the new estates that they put in are not designed for people to walk. They don't have community shops. They have as much driveway and parking facilities as possible and access to a main road. So it sounds like a great role. It's something that should be doing, but I don't think we do think about it enough, because we're still like the convenience of you get in the car to go to the shop. I still think we're not doing it quite right yet, but I'm sure there are probably roles. I don't know how successful they've been, but that'd be interesting to know more about.
And then you don't know, do you, whether, I mean, I live in an area where there are ample facilities for exercising. Does that mean everybody exercises adequately?
But do we need a gym? No, we just need walkways. We don't. I mean, that's the other thing. Let's not push people into gyms who don't want to go to gyms. They don't need to go to gyms to do exercise.
No, exactly. So what do you think? You've mentioned your Achilles, Guy, and your lady with the dactylitis. Are there any areas that you repeatedly see what you would describe as poor care? Are there any, for physiotherapists particularly, do you think there are any areas where we really could be of use in that early intervention, prevention, education role more than others?
I think it's just informing people about natural healing.
Right.
I don't like to do us out of a job, but the body is amazing and actually is designed to heal, despite who you go and see or what they try and do to you. And I think it's reassuring people. So it's like your rotator cuffs. They are going to take a good 3 months to get better, despite what you throw at them. And I think it's just having that backup knowledge that that's okay. And it's okay to tell the patient, this is going to take a while. It will go up and down a bit. The recovery journey is never that lovely straight line. It always is a bit of a bumpy road. And it's teaching them how to deal with it, isn't it? And how to manage the setbacks.
It's how that message lands, isn't it?
So I think we can improve on that. Just, getting people to be a little bit more patient and really informing them about healing and time factors.
Yeah, and sitting with the discomfort of their comeback on that sometimes, because sometimes you deliver that message, don't you? And then it's sort of half taken on, but then it comes back, yeah, but what are you going to do about it now? And the temptation then to bring the fix in, there's sometimes an uncomfortable period of time, isn't there, where you yourself have to be quite strong with that message and sit with it perhaps a little bit longer than is comfortable for either you or the patient.
Yeah, no, and I think and it's not, not being totally against using some things that might give them some temporary relief. If they want to use heat, they want to use cold, they want to take some painkillers for short term or use some gel, no problem. I'm not worried about any of that, and support them to do that. But just say, well, that's fine. This is the healing process, and then we need to get you back and get you weight bearing. But just trying to reduce that chronicity and that worry that people have, because I shouldn't be going into any pain. It's like the classic sort of tendinopathies, isn't it? We do need to sort of just nudge a little along to progress. But it's having the confidence and the conversations, isn't it? And yeah, as you say, it's not going to work with everybody, and there's always going to be people, as certainly if you work in the persistent pain world, that there's always going to be people still searching for a quick fix, or this is what I want. But in acute injuries, we really should be able to work that message quite well.
Yeah. And people that aren't watching this on video, I can tell you, Katie and I are a similar vintage in physio. Wise women of physio, I think we'll call it, Katie. But yeah, we probably started out about the same time. Gosh, if you were an ESP in St George's, then I have huge respect for you in that era. That must have not been the easiest position in the early days of ESP roles. But I don't know about you, Katie, but I remember as a young sort of keen physio wanting to change the world, there were certain things that frustrated me 20, 25 years ago. I actually wrote a master's dissertation on whether we should be looking at pain mechanisms rather than tissue injuries. And I felt at that time that you just mentioned pain, that great things were changing. I was really at this pivotal point in pain management, and we were going to ditch all the tissue related injury focused care, and we were going to go towards understanding physiology and pain mechanisms, and I was going to be part of that. And I'm building this up to sound like a really depressing story, aren't I? But that particularly for me, it has been exciting, and I'm glad to see things being accepted, but that's felt like a really blimmin' slow journey through my career. And I know you're involved in pain now. Are there things through the sort of 20-25 year history of our careers, what changes would you have liked to see maybe go faster, or what changes have happened that you have been really pleased about? What are your reflections?
I suppose, that's quite a big question. Yeah, so from the pain side, I found it fascinating to watch, and I suppose slightly frustrating in that you're either one camp or the other.
Yeah,
and I don't think that's right.
No.
Because we know we can have a specific tissue injury. Yeah. So you have your, and then yes, your beliefs and everything will influence how that pain affects you. I get that. And there's obviously the bigger picture with, and all the fascinating stuff that's still coming out, and, Mick Thacker's stuff that I always try and understand. So there's some, there's some great stuff out there. And I think that is exciting. But I think we do need to, I suppose this is for an example, is a student physio I was talking to who'd suffered with a persistent pain herself, and then was very interested in the persistent pain side of things, which is great. But I did sort of point out to her that she does need to keep an eye, that she doesn't therefore miss any sort of rheumatological presentations that potentially could have had pain for a long time because it hasn't been diagnosed or picked up properly. So I'm always wary. So I think it's great that's moving forward, and let's hope it all moves, but I think it should move forward together. I don't think we should separate it out.
No, actually, I was talking to a student chiropractor a few weeks ago, and she presented almost exactly the problem you've just described. She didn't use these words. This is a bit of a disservice to her, but it was, to paraphrase, basically, I'm being taught this stuff at college, and I know I've got to encompass other ways of behaving. Some of my lecturers are this camp, some of this camp, and I've got to work out where I sit. And that's quite hard at student level, isn't it? To feel like you're being taught two different paradigms.
Yeah, we just learned whatever we were taught.
Yes. And then unlearned it for the next 20 years.
Yeah, but which wasn't a lot. So I think the pain thing's good. I worry I'm pleased about the FCP roles, sort of, but I worry, are we losing that skill, that support, that rehab that physio really needs? Are we driving these really potentially fantastic physios straight into an FCP role and then not actually nurturing our patients? To me, it's a bit like being a sort of, a locum teacher. Are you actually, understanding what's happening to your patients? I don't know. So it's an interesting one. I think it's incredibly exciting, and it's a role I would have jumped on if I was sort of 15 years younger. But I'm just hoping we're not losing some of the stuff that we need to do, that our patients really need.
Yeah, I mean, that rehab is where our profession started, isn't it? And that's where that stuff, that whole patient care comes in. It doesn't come in the assessment and the diagnosis. Well, it does, but because that will influence what's going on.
It's that continuity of care that I worry that we might be losing a little. And and you can tell me as many feedback forms or whatever that the patient said, but as a private practitioner, you probably found the same. I'm picking up a lot of patients who have been to an FCP and are not, are needing extra care beyond what the FCP saw, which isn't surprising because you're under pressure in a 20-minute appointment. So it's interesting. So I will be interested to see where that goes. But I'd like us to really promote our, the support that we can do, the, following a patient through and really, and caring at the end of the day, which is presumably why most of us went into
it. We'd hope so. So do you have any idea where this might go for you? I mean, you're doing really exciting things with Boots. I know you've been exploring new ways of promoting Physio Fast Online. Where do you see yourself going next with this, or it taking you?
I don't know, really. I suppose I'm supposed to have an answer to that, which I haven't. Moving forward, I mean, I presume I will probably carry on keeping an eye on what's going on online, but I would hope to be able to promote more health promotion, advocacy. I don't know, depends what word at some point. I mean, I'm doing a few lecturing positions with a few different physio schools, and I want people to be excited about physio. I want patients recognizing that physio really can make a difference, and it's not just sent to the physio. Actually, it's a really positive thing, and I want every patient to go away thinking, yeah, okay, they couldn't help me, but they've told me what I can do and who I should see. So if you can't help them, you still guided them, and that's my thing, is that I want every. So it's that every contact counts, all of that, get it right first time, all of that sort of stuff the NHS has used. But I really feel passionately that that's what we need. So I don't know where it will take me. It's certainly taken me on a bit of a journey, in that I'm far more knowledgeable now in women's health, and done random video on Boots about incontinence and trying to promote exercise for that. What else am I doing? So I'm just started a pain management sort of training module with Pete, more of Pain Toolkit fame, which we plan to do in the UK, Australia and Canada. So there's lots of things that have arisen from it that, again, are trying to promote and help and support patients. So I like to think of myself as trying to help patients, and that is my primary role.
Well, doing it very well, and I'm sure it will take you to interesting places. Actually, just tell us a bit more about that course with Pete. More if people are interested, how do they find out about that?
Yeah, so that is a 5-day, each session is 2.5 hours workshop, which is coaching. Predominantly at the moment, it's going to be for patients suffering with persistent pain, and the idea is that we really set them some goals and action plans, or we get them to set their action plans and goals. That rather than going away and thinking that was interesting, oh yeah, I know about pacing now, we really test them and get them to understand what pacing means to you. Plan is to roll it out so that we can train people up to do the coaching as well. So it's sort of got a bigger picture, but it's set up with Pete and Keith Meldrum and Mary Wing. So it's a patient collaboration. And I think it'd be really exciting. And the idea is that it's sort of followed through with a private Facebook group so that everyone will be supported. So there'll be that ongoing thing rather than you've done it now, off you go.
Yeah.
So yeah, we're going to see where it goes.
Sounds
Talking
great.
to Toolkit University, and yeah, I'm hoping to move it.
And where will you be advertising that if people are looking?
So, Pete's be advertising it all over
That's
the
down
place.
to Pete. LinkedIn,
Yeah,
if I know
he's,
Pete.
he's far hotter on those sort of things than me, so he'll be putting it out on LinkedIn and Twitter, I assume. But
What
yes,
did you say it was called? Apologies if you said it.
Oh well, it's going to be called Pain Toolkit Plus.
Right.
Yeah.
Yeah, and everyone knows that's Pete, the Pain Toolkit stuff.
Yes, yeah. Well, I think he's done such great work with it. It seemed a shame not to use that. And yeah, no. So I think it would be really exciting.
Great.
And that's just a bit of a change of scene for me. So it's good.
Yeah, exciting. One last area I wanted to chat about with you, Katie, is something I've been thoughtful about. The number of times I see the phrase patients really don't know what we do. And it's a fair call, but I'm almost at the point now where I've heard it so many times. I think, well, whose fault is that and what we can do about it? And I think it ties in with your health advocacy thoughts, because if they don't know that what to access a physio for or what a physio can support them with, then yeah, we are. I don't know. Do you think that conversation is related to our sense of being undervalued, or that we can't provide what we want to provide for the patient, or we're being underused? What do you think's behind it?
I think it's very difficult, and I think it depends obviously in what sector you're working in, because the NHS is, horribly pushed, and by the time patients get to see physios there, it's, they can't deal with the whole bigger picture. In private practice, I think we have a slightly more, it's a bit more relaxed, and we potentially have more opportunity to have the conversations that you might not manage otherwise. I think I don't think we can keep on beating that drum and moan. I think we just need to check that we are providing the best, that we're checking as a profession that we know we're providing the best information. And, and there's a lot of sort of infighting and bickering and rubbish. And I'm not really interested in that. It doesn't excite me in any shape, way, or form. I've never been into that. I think what we need to think about is what do the patients need from us, and are we giving them what they need? And if we're doing that, then that should filter out nicely.
Yeah, I suppose that goes right back to my question that I asked you about the video consultations, and you very correctly answered that the most important thing is to ask the patient what they want. If we're struggling with our identity and what we are, which sometimes I think is the reason that question keeps coming up. Patients don't know what we do because we don't always know what we do. But you can take it right back to that same point. If we go back to what in 2021 do patients need from physiotherapists, and we get clear on that, and as you say, we make sure we're providing that in the best quality way, that is what physiotherapists do, and then that's what we talk about.
Yeah, so I mean, what we are is we're to promote people having a good quality of life, or as good as they are able within their physicality or whatever. So I don't care what people, whether you do it by a video consultation, you do it by a face-to-face, it doesn't bother me that you are enhancing that patient's life and that you are making that difference, and you are helping them set their own goals, and that they have things to do. And it's not you setting them, they're setting them. So that patient should be in control of the dreaded journey. But that's what, the patient should be in control of it. You shouldn't be dictating, well, I'm a physio and this is what I'm going to do. And I know that sometimes some patients want whatever because this has helped me in the past. Well, actually, okay, we'll do a little bit of soft tissue work, but actually, if we then add this in, it's so easy to. I don't understand why it's so complicated.
We do like to make things very complicated.
I'm quite simple, so I don't really get it. I think, so okay, they want a bit of soft tissue stuff. Absolutely fine. We know the power of touch is great. I mean, I know perhaps I shouldn't be selling that because I'm obviously trying to do more video stuff, but there is an element that it is useful, and if it's useful buy-in, then use that buy-in, but then check you go on to promote what you know will be the right thing for that patient, and then you've not lost anything.
No. A couple of years ago, pre-pandemic, I was at a really interesting day event where I was the only physio, and 7 or 8 other people there were medics, and we were asked, very different for medical sort of CPD stuff. We were asked to we were taken into this kind of relaxation process and then asked to really allow ourselves to think way into the future and just write down what came to us about what we saw for many years into the future and what healthcare looked like. And every single one of us, the one thing that we all had in common is every single one of us said there are no doctors, physios, health professionals. We all had some version of there is a world where people are educated appropriately at each stage of their life. So it's almost like you've got 5 different periods of education where people have a baseline level of knowledge about how to look after themselves. And if they don't, they also have tiered access throughout communities of who to go to for support. And then ultimately there are these, I don't know, wise people in certain fields where, if you really need them, if you've exhausted your own resources and those of the community around you, then there is this next level. And every single one of us as health professionals had some version of that vision, which is fascinating.
Yeah, I like that. Yeah, because that's all we are. We should be part of a support network to get people living their lives to the full. And that's all it is. It doesn't matter whether it's physios, chiros, osteos, it doesn't matter. But we should all be sort of, taking that forwards.
It'd be really interesting because you describe, I hear a lot of physios describing themselves as generalists, and it will be interesting in the more immediate future to see whether there is merging of physio, osteo, chiro, some elements of nursing and medicine. Maybe that's why we struggle with the definition, because we're all kind of merging.
Yeah. And I think that potentially that's exciting. I think it's great to have those conversations and open that out. So some of the MSKR stuff that's moving that forwards and opening us all out to each other, I think is really great.
Oh, thank you, Katie. It's been really interesting, and I'm sure people listening will have wanted to get in touch with you on various different levels. Some people might be specifically interested in the Physio Fast video consultation stuff. Some people may have been really clued into or interested in the health advocacy conversation, and there's that great course you're going to do with Pete, or series of courses. So is there one way that's best for people to get in touch with you for all of those things, or different methods for different parts of your varied working life? What's best for people?
Well, either Katie Napton on LinkedIn, I guess, or at Physio KTK, or at Physio Fast on Twitter. Any of those will work, and then we can take it from there.
Yeah, I would encourage people to do that. Katie is a very experienced lady, and as you've heard, got fingers in lots of very interesting pies.
Yeah, that's right.
And we'll work on that, accepting compliments. Thanks so much, Katie. It's been a real pleasure talking to you. Thank you for being a guest on this episode.
It's been nothing but pleasure, Jo.
And we'll leave it there, shall we? Thank you, Katie. I hope you enjoyed session 10. I know Katie enjoyed being a guest despite that teensy weensy bit of sarcasm at the end. Joking aside, what a great guest Katie is. I'm full of admiration for the way she is still at the forefront of what's going on in our profession, and in fact spearheading many of the changes which we're undergoing at this time. Do check out some of the links that Katie referred to, get in touch with her, support the things she's working towards, because as she said on the podcast, she is always the person advocating for the patient. She just wants to make sure patients get the best care possible, which no one can argue with. So do go and check out her platforms. If you would like to find out a little bit more about MeHub, MeHub, I don't even know the name of my own company. MeHub is actually the community, which you can find out about on MeHub, the website. But MeHub is also a place you can find previous episodes of You Matter, information about coaching, if that's something you're interested in, courses, and access to, as I say, the Me Hub community. That's somewhere where I post articles, blogs, hold conversations about things that I'm interested in at the moment, and I encourage other people to raise questions and express opinions about all things related to clinician well-being. So not directly clinical conversations, more things about you, the clinician. So as ever, take care of yourselves. It's a busy period of the year, or it can be, can't it, if you allow yourself to get drawn into all the December madness. I expect more than ever you are running around being a lot of things for a lot of people. So if you get the chance, or make sure you get the chance, to stop and breathe and rest, because you matter.